Doctor, how long have you worked in the COVID wards?
Yes, so I spent pretty much the most of 2020. I was there, and some months in 2021. Um, we really took the front of the burden of the patients with COVID in the ICU.
Did your team know exactly what to do, or was information developing over time?
Our division is an academic division, and so we do a lot of research. We're very inquisitive. We're up to date. So we have a close contact with the people in Italy, people in Spain, and people in the UK. We would hear what they were doing, how they were approaching the crisis. That was the advantage. The disadvantage is that it created a lot of tension because, and then I think we were ready, but you're never fully ready to. I mean, I wasn't ready mentally to it. What happened was just really, even though they were telling us that was going to happen, it's until you actually see it and you're swimming literally in that wave is that when you're like, okay, this is real. This is something that I have never seen in my life before. And this is something that none of my colleagues, even the older ones, younger ones, all ranges had never experienced in their lives. COVID-19 presented a huge challenge because we didn't know how to treat it initially. When we started the pandemic, it was just kind of like trials of this and trials of that. And the most tricky part is how to manage these patients because it's a new disease for us. And even though as a lung doctor and a critical care physician doctor, I have experience with managing advanced or very difficult infections, this scientific method is a little bit out of the window because you have the patients in front of you. Obviously, after seeing hundreds of patients with COVID, we got definitely more comfortable, more proficient, more effective. And I think our outcomes improved as the time went by.
Did any member of your team succumb to COVID?
We did have several of our parts of our team get infected. Well, one of my patients actually, who was a nurse in the Express Med at University Hospital, unfortunately passed away from COVID-19. So I did lose a close patient of mine that had been mine for many years. He had a chronic lung condition that I was treating as an outpatient, and unfortunately, young gentleman, very active, and a fantastic guy. I really liked him, and I was very disturbed when he missed an appointment. And I said, "What? That's very weird. He never misses an appointment." And I looking into his chart, I saw that he had unfortunately succumbed from the COVID-19. I think in the end, we're very grateful that the majority of the core of my team were safe, and in the end, we're able to survive this pandemic. Because, as you may imagine, um, it was we were in the front lines day to day, day to day, day to day. Mark, we were 12 hours, 18 hours sometimes, touching, moving, with our hands fully into the COVID-19 pandemic. I don't know if you can get even deeper when you're intubating the patients and trying to just save their lives. And I'm pretty robust, I'm not gonna lie, with when it comes to seeing things, and just because as an ICU doctor, you've seen everything. But this has shaken my foundations. Some people have made an analogy that we went through war. Just this week, we admitted two patients with COVID-19 that were very sick to the ICU. So it is not yet done.
Every time that you guys walked into those doors, you walked into a place where death was prevalent. There had to be a question in the back of everybody's mind as they opened the door and walked in: is this my time? The thing that drove you guys forward is the Hippocratic Oath. And your allusion to war. In the military, we take an oath to defend the country. And so when the bullets start flying, you go where the bullets are coming from. You don't run away.
Yes, I understand. Yeah, it's a difficult situation. But on the positive side, because we always have to be positive,
Oh yeah.
he has brought um, our teams together. It has energized other people like yourself, composing music, organizing positive things. The COVID 19 type of pandemic is dying down, and we hope that as you know, other countries are still battling, like India and some of these other places around the world. We hope that this this will get better for everyone, and definitely we see the light at the end of the tunnel.
On behalf of our members, I just want to say thank you to you, to all the members of your team, and to all the members of the medical community worldwide that stepped up and went where the hard job was.
Thank you so much. Your words mean a lot. They really do. Thank you.